Hello everyone, welcome to Dentistionary. We are back in human physiology with the last topic in the unit respiration, that is hypoxia. You guys can ask your doubts in our comment box. We'll surely respond to those questions as soon as possible. We also provided the PPTs of the slides in our description box. So let's begin with our today's lecture. Firstly, what is hypoxia? Hypoxia literally means the lack of oxygen at tissue level, whereas anoxia is an another term which refers to complete absence of oxygen in the tissues. Coming on to its classification, hypoxia has been classified into four major types. They are the hypoxic hypoxia, anemic hypoxia, stagnant hypoxia, and histotoxic hypoxia. What are they and what are their causes will be described in our next slides. Moving on to further details, first is the hypoxic hypoxia. What is hypoxic hypoxia? As the name suggests, hypoxia means low arterial pressure of oxygen, or you can say the partial pressure of oxygen, when the oxygen carrying capacity of blood and the rate of flow of blood to the tissues are normal or elevated. Coming on to its example, we can say hypoxic hypoxia or generalized hypoxia occurs at high altitude where the concentration of atmospheric oxygen is decreased, or in deep sea diving if there is an inadequate supply of oxygen in the breathing gas, or if a rusting cylinder has extracted oxygen. Next, we have the characteristic features. It includes the low arterial partial pressure of oxygen, the low arterial oxygen content, arterial percentage oxygen saturation with hemoglobin, and the arterial venous partial pressure difference. यही चार पॉइंट के बेसिस पे क्वेश्चंस लाइक डिफरेंस बिटवीन द हाइपोक्सिक हाइपोक्सिया एंड स्टैग्नेंट हाइपोक्सिया और हाइपोक्सिक हाइपोक्सिया एंडेमिक हाइपोक्सिया कैन बी आस्क्ड इन योर टर्मिनल्स एज वेल एज प्रॉफ्स. कॉजेस वही सेम रहेगा. नेक्स्ट वी हैव द एनेमिक हाइपोक्सिया. व्हाट इज एनेमिक हाइपोक्सिया? Anemic hypoxia is the type of hypoxia in which the arterial partial pressure of oxygen is normal, but the amount of hemoglobin available to carry oxygen is reduced. This type of hypoxia is known as anemic hypoxia. Means the partial pressure of oxygen so normal रहता है, but the amount of hemoglobin to carry that oxygen is low. Clear? Next are the causes. The causes include anemia, hemorrhage, and the conversion of hemoglobin to some abnormal form. For example, in methemoglobin, the iron in the hemoglobin is present in Fe3 plus form instead of Fe2 plus form. Carboxyhemoglobin, where carbon monoxide combines with hemoglobin. Next are the characteristic features, which includes as hemoglobin content is less than normal or it gets converted to some abnormal forms, thus normal hemoglobin content is reduced by 50%. Arterial partial pressure of oxygen is normal as there is no defect in the alveolar ventilation rate or the pulmonary blood flow. And then the oxygen content of arterial blood is less than the normal. Obviously, ये सारे characteristics हमने definition में already पढ़ रखा है. अगर example properly देखा जाए तो it can be said anemic hypoxia is relative anemia caused by decreased oxygen carrying capacity of the blood. In anemic hypoxia, it is due to the massive blood loss. The two common causes include the carbon monoxide poisoning and methemoglobin. All these we have already discussed. Now, next, the characteristic features already been said. Moving on to the next type, it is the stagnant hypoxia. Hypoxia in which the blood flow to the tissues is so low that adequate oxygen is not delivered to them despite of the normal क्वांटिटी प्रेजेंट. मतलब ऑक्सीजन की मात्रा नॉर्मल रहती है बट ब्लड फ्लो इतना कम होता है कि वो उस ऑक्सीजन को कैरी नहीं कर सकते, मीन्स adequate oxygen is not delivered to that part, right? Again it is again if I repeat this, the hypoxia in which the blood flow to the tissues is so low that adequate oxygen is not delivered to them despite a normal arterial partial pressure of oxygen, and hemoglobin concentration is called stagnant hypoxia. Causes क्या है? Two major cause: the circulatory failure and the hemorrhage. Clear? Next, including the characteristics, same as I described in the definition. The normal arterial partial pressure of oxygen, normal oxygen content, normal arterial percentage oxygen saturation with hemoglobin, but the arterial venous difference is more than the normal. That is, it is approximately 70 millimeter hemoglobin. The last type is the histotoxic hypoxia. It is a type of hypoxia in which the amount of oxygen delivered to the tissues is adequate, but because of the action of certain toxic agents in the tissue cells, it cannot use much of the oxygen supplied to them. मतलब adequate oxygen supply तो होती है, but due to the presence of certain toxic substances, that adequate quantity is cannot be used. Clear? थोड़े कंफ्यूजिंग से ये टाइप्स, बट दो तीन बार रिपीटेडली आप अगर पढ़ोगे तो ये क्लियर हो जाएंगे. Coming on to its causes, the most important cause is cyanide poisoning. Histotoxic hypoxia also refers to the reduction in ATP production by mitochondria due to the defect in the cellular usage of oxygen. Obviously, oxygen का usage अगर कम होगा तो mitochondria ATP भी कम produce करेगी. Clear? Characteristics वही same रहने वाला है. These are the graphs where the first one is of the normal cells, second one is of hypoxic hypoxia, third is the anemic hypoxia, fourth is the stagnant, and lastly it is of histotoxic hypoxia. Clear? ये सारे ग्राफ आपको हमारे पीपीटी में मिल जाएगी, that we provide you in the description box. Coming on to our next topic are the effect of hypoxia. Yes, please keep in mind hypoxia as a long note पूछा जाता है आपके टर्मिनल्स एंड प्रॉफ्स में, तो उस अकॉर्डिंग अपने नोट्स बनाइएगा जिससे लॉन्ग नोट की तरह लगे, नॉट एज अ शॉर्ट नोट, बिकॉज ऑब्वियसली लॉन्ग नोट विल बी ऑफ at least 7 to 10 marks. Next, we have the effects of hypoxia. Hypoxia affects mostly our respiration, our CNS, and the CVS. All types of hypoxia except anemic hypoxia stimulate the peripheral chemoreceptors to increase respiration. एनेमिक हाइपोक्सिया को छोड़ बाकी सारे टाइप ऑफ हाइपोक्सिया हमारे रेस्पिरेशन रेट को बढ़ाती है. क्लियर? नेक्स्ट इज द CNS. In all types of hypoxia, brain is firstly affected, and the symptoms include like that of the overdose of alcohol. Just like on overdose of alcohol, the symptoms like drowsiness, impaired judgment, impaired vision, blood image formation, that same are the symptoms caused on the CNS. Other symptoms include depression or excitement, headache, loss of self control, disorientation, and loss of time sense. Next, coming on to its treatment, oxygen therapy, or firstly, I would say the treatment depends upon the type of hypoxia, and the major treatment include is oxygen therapy. Detailing करने की इतनी ज़रूरत नहीं है. Moving on to its applied aspects, cyanosis. It is also, please mark it as important short note. What is cyanosis? Cyanosis simply means the bluish coloration of skin or other mucous membrane due to the presence of at least 5 gram of reduced hemoglobin per 100 milliliter of blood in the capillaries. Sites कहाँ कहाँ होती है? It is mostly found in the mucous membrane, lips, earlobes, nail beds, and tip of nose. Causes: apart from anemic hypoxia, all other type of hypoxia are included as a causative agent for cyanosis. Mostly included are the hypoxic hypoxia and the stagnant hypoxia. Other factor which cause cyanosis is polycythemia, that is increase in total hemoglobin content. Another local factors include the exposure to mild cold and the exposure to severe cold. Yeah. So that's the end of our unit respiration. Our next lecture will be on excretion, where we will describe, we will teach you the mechanism of urine formation, the countercurrent mechanism, and obviously introduction to excretion. Thank you so much, guys. Keep learning and keep supporting our channel, Dentistionary. Thank you.